Hello, welcome to any community. In this particular video, we are going to discuss the importance of examining umbilicus in per-abdominal examination. From past several videos, we have started with the discussion of inspection of a per-abdominal examination, starting with the contour of the abdomen, followed by abdominal asymmetry, later state of the skin in per-abdominal examination. In today, we are going to discuss state of the umbilicus in per-abdominal examination. As far as status of the umbilicus is concerned, so it is considered one of the natural landmark of the abdominal, uh, that is the abdominal examination. So here we are going to look into the discharge which is being present in the umbilicus, and we are going to note about the position of the umbilicus, and later we are going to see the direction of the umbilicus as such. So this is one particular condition where there will be the protrusion of the contents of the abdomen will be taking place through the umbilical aperture. So the most of the cases it will be intestines that are going to get projected through the umbilicus as such. This is what we can say the smiling umbilicus, wherein the transversely stretched umbilicus is being seen. This is indicative of the presence of the fluid in the peritoneal cavity. What we can say the ascites will be diagnosed in this particular occasion. This is the vertically stretched umbilicus. This is indicative of the large ovarian cyst. In case of the ascites, it is the transversely stretched umbilicus. In case of the large ovarian cyst, it will be vertically stretched umbilicus is being seen. This is the invagination of the umbilicus will be observed. This is specifically seen in obesity. Discharge through the umbilicus may indicate infection of the umbilical region. So here, the direction as such of the umbilicus will be observed. When you think about the direction of the umbilicus is downwards, it is indicative of the person is suffering from the swelling related to upper abdominal region. For example, the liver or spleen or gallbladder, etc. Whereas the direction of the umbilicus, if it is facing upwards, it is indicative of the swelling which will be arising from the lower part of the abdomen, maybe the urinary bladder, or maybe the uterus, or maybe the sigmoid colon, or maybe the what do you say that the appendix, etc. So like that, the direction of the umbilicus, if it is upwards, it is indicative of a lower abdominal swellings as such. The take-home messages from today's discussion are the features of the umbilicus of the individual will be giving many clues to the diagnosis as such. For example, invagination of the umbilicus in case of the obesity, or discharge of the pus through the umbilicus may indicate the umbilical infection, and upward facing of the umbilicus may indicate lower abdominal swellings. Transversely stretching umbilicus may indicate ascites. Vertically stretching umbilicus may indicate the that is the large ovarian cyst. So like that. So thus this has to be looked into along with the other physical examination of the inspection. The per abdomen has to be taken care of. For example, if the person is having the what do you say that is stretching of the skin, and direction of the umbilicus is considered to be upwards, this particular stretching of the skin as well as these two signs may indicate the person may be suffering from the chronic abdominal, that to lower abdominal swelling. Dear any community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you would like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.